Hey Phoenicians, welcome back to the channel. Today we're exploring the gripping narrative of ITV's Malpractice. We'll look into how fiction often mirrors reality by discussing real-life documented cases of malpractice in therapy settings as well. In Malpractice Season 2, we follow Dr. James Ford, a psychiatric registrar entangled in a tragic sequence of events involving a new mother experiencing postpartum psychosis and a pregnant woman battling addiction. The series looks deep into the complexities of medical ethics, decision-making under pressure, and the dire consequences of systemic failures. Now, while Malpractice is a dramatized series, it isn't that far off from real-world instances where lapses in judgment and ethical breaches have led to serious consequences. A study published in the Journal of Psychotherapy analyzed complaints filed against therapists, revealing that common issues included boundary violations, inadequate treatment, and failure to manage transference and counter-transference effectively. Before we begin discussion of the two real cases, I just want to mention that they contain discussion of sexual violence and emotional harm in a therapy setting. If these topics are sensitive or triggering for you, please take care of your emotional well-being and feel free to skip this video or return when you feel ready. These stories are shared to raise awareness about ethical responsibility in therapy. So, let's consider the case of a therapist who engaged in a dual relationship with a client, leading to emotional harm and a loss of trust in the therapeutic process. The therapist, who was based in the UK, developed a friendship with the client outside of sessions, texting regularly, attending some social events together, and eventually confiding personal things during the therapy sessions. The therapist framed this as a mutual human connection, but over time, the client felt emotionally responsible for the therapist's well-being. The therapeutic focus blurred, shifting attention away from the client's healing. When the client tried to re-establish boundaries, the therapist withdrew emotionally, creating distress and abandonment feelings in the client. The client later reported emotional harm, confusion, and worsened mental health. This case was brought to the attention of the Professional Conduct Panel of the BACP, which concluded that the therapist had breached the ethical code relating to boundaries, power imbalance, and emotional safety. Such breaches stress that no matter how much we may like our clients and want to be friends with them, or even if they ask us, which by the way I have been asked, we must remember we are their therapist and not their friend. We have a responsibility of care toward them that goes beyond what a friend would be expected to do, and so we must maintain professional boundaries to safeguard our clients rather than harm them. Now to the next case. Meet Jessica Wing, who sought therapy to heal from the trauma of sexual violence. Trusting her therapist, she bravely shared her experiences, only to be met with a dismissive response. "You feel like you've been raped." Such a statement not only invalidated Jessica's experience, but also caused significant emotional harm. Feeling unheard and re-traumatized, she discontinued therapy and refrained from seeking help for several years. These cases highlight the importance of therapists adhering to ethical standards, ensuring they provide a safe and validating environment for clients. Missteps, even unintentional, can have lasting negative effects. Therapists must be vigilant in their language and approach, especially when dealing with trauma survivors. Empathy, validation, and adherence to ethical guidelines are paramount to effective therapy. Beyond individual accountability, systemic issues such as a lack of regulation can exacerbate the risk of malpractice. In the UK, titles like psychotherapist, psychologist, and counsellor aren't legally protected, allowing unqualified people to practice using them. This gap has led to calls for statutory regulation to ensure public safety. But in the meanwhile, it's important to do your research into the training and experience of anyone who uses these titles. These cases highlight the responsibility therapists hold, and professional organizations like the BACP and BPS provide ethical frameworks to guide practitioners. These frameworks emphasize the necessity of competence, integrity, and respect in therapeutic relationships. So, while the show Malpractice offers a dramatized glimpse into the challenges faced by healthcare professionals, it also reminds us of the real-world implications of ethical lapses in therapy. Upholding ethical standards, seeking supervision, and advocating for systemic reforms are necessary steps towards ensuring safe and effective mental health care. Let's ensure every therapeutic encounter fosters healing and trust. If this discussion resonated with you, please like, share, and subscribe for more insights into mental health and ethical practice. And remember, if you're seeking support, don't hesitate to reach out to us at Phinity Therapy. Bye for now.